Hi, I'm Joe Fifer, President and CEO of HFMA. Welcome back to our web video series. This month I'm talking about the impact of MACRA. MACRA does a couple of things. One, it encourages physicians to participate in alternative payment models, or APMs, that would hold them accountable for cost and quality of care. Two, it encourages physicians to adopt interoperable electronic health records, or EHRs for short. These two things are connected. Specifically, MACRA requires use of certified EHR technologies to participate in a qualifying APM. They should be. We know fee-for-service is flawed in that it has led to the fragmented healthcare system. It figures, therefore, that society stands to benefit from a push to promote adoption of APMs. With regard to EHRs, the lack of interoperability is a major flaw that is holding back our efforts to coordinate care in our fragmented system. So the goals of MACRA are right on target. The issue is that APMs and EHRs don't come cheap. They both require considerable technical knowledge, administrative bandwidth, and financial resources. For example, the first-year cost of implementing EHRs in a 5-physician primary care practice has been estimated at over $200,000. In the case of APMs that involve downside financial risk, significant financial reserves are required. Heck, even figuring out what qualifies as an APM has its own level of complexity. Simply put, complying with MACRA will not be simple. Many small and mid-sized physician practices just don't have the resources for these things. So naturally, they're going to gravitate toward alignment with hospitals and health systems, those entities that appear to have the resources to invest to be able to understand and adopt the provisions. Even large practices may be driven in that direction. Exactly. Consolidation is already happening, of course, but in a MACRA environment, the pace will pick up. So basically, we have CMS encouraging physicians to move in directions that can best be achieved through consolidation. At the same time, we're hearing a steady drumbeat of concerns being raised about consolidation by other federal agencies, such as the FTC and the DOJ, as well as from the business community and other interested parties. Now, if the concern is about a monopoly developing, that's one thing. Most people would agree that monopoly power is not a good thing for consumers. But true monopolies are not very common for the majority of our population. The real issue is that so many of us want to have health plans with a full range of choices, including the BMW and Cadillac hospitals and health systems. In other sectors of the economy, this sorts itself out. Most people don't think they have a right to own a BMW. They're content with a Chevy, if that's what they can afford. But healthcare is different. Health plans know their members want BMW hospitals, so the predominant health plan benefit package has been an all or nearly all provider model, even in markets that are beginning to accept narrow networks. I would argue that this isn't a market dominance issue, as the FTC defines it. Let's recognize it for what it is, a reflection of the desire to have it all. That's a debate in and of itself. Is healthcare a right, and does that right include the right to access all providers? That is a debate for another day. That said, I would argue that the outcry about market dominance will only increase, directly related to MACRA. In other words, perhaps the left hand is saying one thing and the right is saying another. The takeaway message is for our policymakers. It's important for them to realize that mixed messages about consolidation can be counterproductive. On one hand, APMs and EHRs, as encouraged by MACRA, require size, scale, and resources that only large organizations can provide. On the other hand, we hear that drumbeat of concern about consolidation, but they can't have it both ways. HFMA approaches this issue from the standpoint of what's best for the care purchaser. That is what we have said in our value project reports. We believe that perspective should guide all of us as we move forward. Thanks for watching. I'll see you next month.